This paper looks at the efficacy of different mouthwashes over a 2-hour period. In this study, they conducted a prospective parallel groups randomized double-blind controlled clinical trial, specifically to test the efficacy of prophylactic rinses in reducing salivary viral load of COVID for up to 2 hours post-rinsing, where they compared the cycle threshold values in saliva between groups and within groups at baseline. They recruited 32 subjects with proven COVID positive cases. And again, they tested at baseline. So before rinsing, post rinsing, which would be 0 hours, and then 1 hour after rinsing and 2 hours after rinsing. And in the study, they observed a significant increase in CT values, which is good. The higher the cycle threshold value, the less severe the COVID case is, which means the lower the viral load. Immediately after rinsing with all of the 4 mouthwashes tested, this included a 0.12% chlorhexidine gluconate, a 1.5% hydrogen peroxide, a 1% providone iodine, and then Listerine. And they also had a comparison to water alone. However, a sustained increase in the CT values for up to 2 hours was only observed in the Listerine group and in the chlorhexidine gluconate groups. Therefore, their evidence suggests that in a clinical setting, a prophylactic rinse with Listerine or chlorhexidine gluconate can potentially reduce COVID viral load in the oral cavity for up to 2 hours, meaning that they advocate for pre-procedural mouthwashing, sort of like hand washing, as both an inexpensive and safe added precaution to mitigate the transmission of COVID from a potentially infected patient to providers. I would also argue that the providers should be doing this as well pre-procedure so that they don't also spread it from them to the patient. So it can really work both ways there. Diving in, most subjects were recruited between February and June of 2021. They were at least 18 years old and were either non-symptomatic or symptomatic but not intubated, so meaning they were mild cases or asymptomatic cases of COVID. In the study, prior to doing the sampling, the patients were asked to rinse their mouth with water to remove food debris. And over the course of the 2-hour study, they were asked to refrain from eating and drinking to prevent interference of downstream processing of the samples. One of the first major findings they found was that the Listerine group performed much better than the hydrogen peroxide and the providone iodine groups. And that sustained effects of the mouthwashes were only observed for the Listerine and the chlorhexidine gluconate group, which supports the use of prophylactic mouth rinses with alcohol-based Listerine or a 0.12% chlorhexidine gluconate to reduce COVID viral load in the oral cavity, where this is sort of the major plot. So this is water right here, so it's basically constant. You're not seeing any effectiveness over time. With the betadine and the hydrogen peroxide, you have a little bit of immediate post-procedural benefits right after rinsing. So this is pre-rinsing, this is post-rinsing. So you have some immediate improvement that instantly goes back up after an hour to baseline levels. And then for the Listerine and the chlorhexidine gluconate, you have it immediately going down post-procedural, sustaining for at least 1 hour, and then starting to head back up after 2 hours. And then this is a secondary plot looking at a different measurement, where again we're seeing the same thing, where we have essentially no change with the water group, which is the black. The blue and green, which is the hydrogen peroxide and betadine, has immediate effects right after rinsing, but those go away after an hour. And then the Listerine and the chlorhexidine gluconate is having immediate post-procedural effects, which is sustained for up to 2 hours, but is already trending, starting back up again. So this likely goes away by hour 3, but it at least has a short-term benefit. So considering this with what we've seen so far, I would list CPC mouthwash as the top. This has clear effectiveness up to 3 hours, potentially up to 6 hours, followed by Listerine. This one would edge out the chlorhexidine gluconate, and I'm giving it that edge because it has less cytotoxic effects at a 50% dilution, followed by the chlorhexidine gluconate.